Hello, my name is Amberine Calhoro-Tinho. I'm one of the medical retina consultants and I've recently joined this fantastic team here at the Buckinghamshire NHS Trust. In this video I'm going to talk about smoking and why it's generally not such great news for your health, but moreover how it affects your eyes. In this video I'm going to cover several questions. Can you remind me how the eye works? Does smoking cause blindness? And if I stop smoking today, will this help my eyes? So when we think about how the eye and the brain work together to help us to see, what I want you to think about is the outside world and light. And light in the form of light rays passes through the cornea. This is a clear dome-shaped structure which forms the external protective layer of your eye. The light passes through this clear window and then passes through the pupil, which is an aperture that controls the amount of light that comes in. Now, as you know, the size of the pupil changes with the light levels, and that pupil size is determined by the muscles of the iris, the beautifully coloured tissue that gives colour to your eyes. Now, the light rays have now passed through the pupil and then passed through the lens, which also focuses light onto the retina. And the retina is the layer that allows us to see. This is the specialised layer of tissue that lines the back of your eye. So in the retina, the highly specialised cells help to convert the energy from light into electrical impulses. The message from these electrical impulses is then transmitted through the optic nerve to take that information to the brain. When we reach the brain, it's the visual cortex that then takes over. And it's the complex processing that takes place in the brain that then allows us to make sense of an object in front of us and the world that we see around us. So as you can imagine, we need healthy eyes, a healthy body and a healthy brain to have good vision. And when we talk about having healthy vision or good vision, what exactly do we mean? Well, perhaps you can imagine if you've ever had your eyes tested, either at an optician's or in the hospital, and there's usually a letter chart. Now, a standard letter chart which is set at 6 meters. The bottom line then would be the line that a person with normal or healthy vision should be able to read clearly. However, in diseases like macular degeneration, vision is very, very much affected, and patients who have AMD may not even be able to see the top line clearly at all. Does smoking cause blindness? Well, the answer to that question is yes. We know that in an average cigarette there are approximately 4,000 chemicals, and you can imagine within your body what kind of damage such chemicals can do. And we're talking about very unusual and very scary sounding substances like carbon monoxide, methanol, ammonia, methane. We also know that in cigarettes there are approximately 66 or so factors or compounds that are known to be linked to the formation of cancer. Now, in addition to the fact that all of these substances are very harmful to the tissues in your body, and particularly the tissues of the eye, we also know that by smoking more, you are also putting your eyes at risk by making any pre-existing eye disease worse, or also putting you at risk of other eye disorders that can cause blindness. When we think about macular degeneration, we know absolutely that smoking is a risk factor. Research has shown us that by virtue of smoking, you're up to 4 times more likely to develop AMD in comparison to someone who has never smoked. We also know that current smokers are actually likely to develop AMD up to 10 years earlier than someone who has never smoked. Can you just imagine losing your vision in your early 50s rather than much later on in your life due to macular degeneration, and how distressing that might be? The other thing that we know about smoking is that other eye diseases can be made worse by virtue of smoking. So for example, cataracts are more likely to develop more quickly, and diabetic retinopathy, another major cause of blindness in this country, is definitely made worse by virtue of smoking. If I stop smoking today, will this help? Yes, absolutely. The benefits are almost instantaneous. We know that within about 20 minutes, your heart rate slows down and your blood pressure drops. Within the space of 12 hours, the levels of carbon monoxide in your blood come right back down to normal. So you can imagine the cumulative health benefits throughout your body the longer that you stop smoking. For example, over 10 years, the risk of developing lung cancer is halved. So we know that by virtue of quitting smoking, your risk of progression to AMD is much less. So for example, if you have managed to stop smoking for 20 years, your risk of developing AMD falls right back down to the risk of a non-smoker. So in summary, we've talked about how smoking can affect your eyes. My personal advice would be to try and stop as soon as you can, or best not to start at all. I hope you found this video useful, and thank you very much for watching.